We want to go back now to that sad news from the front lines that you heard just a few moments ago. Dr. Lorna Breen, a top emergency room doctor in New York City, treating COVID-19 patients who died of suicide. Let's bring in Dr. Jen Ashton now to talk about this toll that this pandemic is taking on our doctors, nurses, and hospital workers. Thanks for joining us, Jen. I want to just get right into the idea that, we've heard, of course, about these stories from the front lines anecdotally, doctors and nurses seeing so much death, working long and taxing days amid so many unknowns. But what's the real emotional strain and toll on them?
Lindsay, it's really so difficult to describe. And it's not just, as you said, hospital workers, but it's first responders. This is, in a lot of ways, very similar to what members of the military see when they're in battle. You have to remember that we go into medicine and healthcare to try to heal people, to take care of people, to save lives. So when you're confronted with this much sickness and death in such a short period of time, it is not only physically taxing, but it is incredibly emotionally taxing as well.
And what kind of resources are typically provided to those who are working on the front line? And do they even have time to utilize them during a situation like this?
Well, there are crisis managers and mental health professionals, social workers, definitely available to healthcare workers, doctors, nurses, first responders, definitely in times of crisis, natural disaster, mass shootings, things like that. The hard part, Lindsay, is that there is a real barrier, especially in the field of medicine, to asking for help. And we have got to change that because we really have to walk the walk and talk the talk and practice what we preach. And so asking for help is not a sign of weakness, it's a sign of strength. And that can be really hard to do in times like this.
And Jen, of course, it's not just the emotional stress and physical stress affecting healthcare workers and others, but we're also learning now more about other more potentially serious consequences of COVID-19 that affect the central nervous system, including, of course, we've talked about headache, dizziness, seizures, but strokes, loss of smell and taste, all neurological manifestations, but also the psychological consequences like cognitive impairment, depression, anxiety, in some cases leading to suicidal thoughts or suicide. So is it really important that we make sure that we not overlook the mind aspect in addition to the body?
Well, so many important things to unpack there, Lindsay. First of all, we have to remember this virus is still not even 5 months old, right? So even though it started as a primary respiratory pathogen, we are seeing now, not just here in the U.S., but from clinical case reports from other parts of the world, that this virus does not discriminate. It literally can attack almost any organ system, and in fact does. Sometimes someone can survive a respiratory illness and then succumb to a psychiatric illness, and we desperately want to avoid that now more than ever.
All right, that check up from the neck up, so essential. And Jen, thank you so much for just your steady hand and your knowledge through all of this. We appreciate it. I want to let our viewers know, if you're struggling with thoughts of suicide or worried about a friend or a loved one, help is available. Call the National Suicide Prevention Lifeline at 1-800-273-8255. That's 1-800-273-TALK for free, confidential, emotional support 24 hours a day, 7 days a week. Even if it feels like it, you are not alone.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.